Maar je had haar aan de lijn van Huis naar Gouden. Ik heb haar met consult gehad.
Oh, ja.
Afgelopen dinsdag.
Ja.
En toen zei ik, ja, wij als bedrijf kunnen hier niks mee. Maar zij heeft op de webshop besteld.
Ja.
Gaat dat dan via ons of via Huis naar Gouden?
Ja, de webshop is aan wij, hè?
Ja, daarom. Oh. Ja?
Okay, good morning, everybody, and welcome to this Endymed Hour special session of this webinar featuring unlocking the potential of FSR. I'm glad you accommodate sometimes everybody to have this 1 hour shared with you. I'll be starting by introducing the team, the Endymed team that you probably, some of you may know already, Asrar, our clinical application specialist, Stella, clinical trainer, and myself. Asrar and myself will share today's responsibility for this session. This session is recorded fully, the presentation section, as well as the live demo section. Both sections, both parts of the webinar will be characterized of sharing some before or Q&As, questions and answers, that we found, common among users and other potential customers as we deal with the FSR. So the communication would be kind of answering some of the questions that you've been raised throughout the last year or the experience we have with the FSR, and then we'll be able to let you also respond or communicate with us through the chat. So feel free to have any comments that you have during the webinar through the chat, or you may want to have also your voice raised so you can interfere and ask questions. So let's start. One of the common questions we have on the FSR is, what is the FSR handpiece and how does it work? What is the key benefits of using the FSR? Which skin concerned conditions can be effectively treated, and how does the FSR handpiece compare to others? All these very common questions. So I'll try to answer. And as you all probably know, the FSR is part of the modular multi-application platforms that we have. The Pro and the Pure, the FSR is operating both and is part of the what we call fractional handpieces family. So today we're gonna focus on the FSR solely, and we'll try to understand what is the position of the FSR among the energy-based devices that we are dealing with in the market. So you can see from this landscape of examples of different technologies we have on the left, the ablative and non-ablative and the fractional ablative lasers that were very common in the past 20-25 years, and get its recognition about the aesthetic market even until today, and they pose their benefits and risks. And then came the radiofrequency microneedling that we familiar with, like the intensive and other modalities that spreads the benefits of microneedling radiofrequency. And on the right, we see the ablative radiofrequency technology, which has of course its benefit and make a difference in the way we're looking at radiofrequency in general in terms of ablation or mini ablation. And FSR is part of the, I would say, the mini ablation approach and its benefits, and we'll see how does it translate. So, our major concern, of course, is the intact skin that you're all familiar with, which comprised of the stratum corneum, the epidermis layer, which is up to between 50 to 100 microns only, and then the papillary dermis and the reticular dermis. These are the places where we want to make the FSR interacted with. So the FSR has its effect on the epidermis initially, and thereafter the papillary dermis. It uses a very unique technology through its tip that is a matrix of 8 by 14, sum up to 112 pins together in interaction with the skin. So the FSR actually is a fractional area of small foci, spot-sized pins controlled by electro-precision pulse at 1 megahertz RF 3D technology. And it creates the epidermal fraction microablation wounds resurfacing without subsequent coagulation and bulk heating of upper dermis, causing collagen remodeling while improving skin texture, smoothness, and laxity. So the FSR works like a scanner, unlike laser scanner, but it has its own unique of scanning the area by induction of pulse electrothermal activation through the pins that it's been in contact with the skin, causing microablation and epidermal coagulation for the upper dermis for fractional skin resurfacing. And the scanner that is being employed here is going, as we see here in the video, going from left to right or right to left, doesn't matter. And after the activation of those pins, it makes its effect on the surface of the epidermis, causing the ablation and mini ablation and subsequent heating. So it goes from fractional RF scanning on the pin's activation through the ablation as a primary cause, and then secondary, the volumetric heating that commences thereafter. So we know what is the FSR major benefits when compared to others. It has a very unique, very effective footprint of thermal signature, where you can see a comparison between our FSR on the left and others, competitors on the right. We can see that the footprint of the FSR is very profound and dense through its 13 millimeter in length. It's part of the footprint. So it's a relatively large footprint when compared to the 8 millimeter only and the vague footprint you can see here with other bipolar technology. So what is the clinical application of the FSR is taking the handpiece as doing a stamping point by point technique by activating the button and sounds interaction while clicking on this green button, clicking and holding for about less than a second. And then you can do the passes in horizontal or vertical orientation. 1 or 2 passes is needed. Do not stack pulses when you do the FSR, not recommended. Treat the FSR treat Fitzpatrick skin type 1 to 5 to 6. I'm sorry, to 6, and it's safe throughout all skin types. In this clinical application, we put EMLA 45 minutes before the treatment with nylon film to hydrate the area. And when doing the treatment, it feels like mild stinging heat sensation. Of course, Asrar will assume responsibility in a few minutes and elaborate and showing you a live demo on our patient. So what is the specs of the FSR? You're familiar, it's quite simple. The screen, the GUI, comprises of anatomical areas which you need to select from the screen, and then select 2 variables. One is the power, which spans from 1 to 6 watts, and the pulse duration 10 to 60 milliseconds. And the gap between the pins is 1 millimeter only. It's a very dense footprint with about 25% density. The FSR tip is, can be clicked easily to be connected and disengaged by pressing those hinges that make it firm onto the FSR handpiece. The FSR tip comes sterile. It goes up to 450 pulses, and it's disposable. We should be aware of the need to clean, make sure we clean the tip every 30 pulses throughout the treatment, at the end of the treatment, and so forth. We clean it with a soft cloth with 70% alcohol. At times, a pop-up message will come up on the screen asking you to clean the FSR, showing how, I would say, delicate technology FSR is all about. So why were you doing the FSR in general? Of course, is addressing aspects of typically of unhealthy skin, and how unhealthy skin, of course, relates to age and photo-damaged skin. So if you're looking at these histologies that we're taking from a publication, just to emphasize what we are talking about when dealing with the FSR is the difference between the young, healthy skin and to the left on the A, and the unhealthy skin for age patients on the B area. What we're looking here, what we see here is the epidermis, the upper epidermis, and the papillary dermis, the DP, and the reticular dermis. As you can see with the healthy skin, there is a quite bold red regions area. Papillary dermis is well engaged with the epidermis, and of course there is a distinction between the papillary dermis and the reticular dermis, where you see the old skin, unhealthy skin. You can see that the papillary dermis is not as dense, and the papillary red regions area are not showing here. And so this is the part where the FSR makes a difference, and should make a difference with the interaction on unhealthy skin or those skins we'd like to regenerate. And this is a good example showing here the transformation, histology transformation that was made between the control and 60 days after final treatment, showing improvements, drastic improvement in the density of the histology of the elastin and collagen. And one thing to recall is that there is a need to induct, of course, heat injury, such as, of course, the FSR. In relation to fractionated technology, of course, this is something that's unique to Endymed. We are able to do fractionation technology impact on the skin in two levels: on the upper epidermis, dermis, papillary dermis level, as well as in the lower dermis or reticular dermis with the intensive. So this is the benefits in combining both FSR and the intensive, even at the same session or in serial. So what is the damage created by the FSR? Can you see here from the histology? These are denoted here on A areas where you see microablations that are in correlation with physical size of the pins, which are about 300 microns in size. So there is a disintegration, disruption of the entire epidermis-dermis interface, including the red regions area and so forth, which is very characteristic of ablation. And then there is a secondary thermal effect on the B area, reversible one, non-ablative thermal effect of the dermis, and C and D areas are normal dermis areas unaffected. So this is a very unique one, showing also the precision of that the damage is being made on the level of dermis, upper dermis junction, and the quick rehabilitation and recovery of the injury that has been made, showing here microcresting, covering the injured area. So the histology benefits of the FSR is by increasing in epidermal thickness, increasing granular layer thickness, development of red regions area, and increased collagen density in the papillary dermis area. The wound healing, when you're starting to look at the clinical aspects, you're familiar with this photo showing the wound healing process before the treatment and then 10 days after follow-up. You can see progressive improvement in appearance of the injury that has been made. Typically, we see demarcation, redness, some puffiness that faded away as we go along the days after. So in general, we see good recovery, excellent recovery for all skin types, most skin types. provided that there is no stacking or overlapping and so forth in several areas that some people tend. So please refrain from doing stacking or overlapping of the FSR. And here is an example of the relationship between the wound itself as the amount of energy is being applied and the healing time. So on the first row, we see a low energy with 5 watts and 40 milliseconds, and you can see progressive improvement and pale demarcation of these crusts. And then when you go down to the bottom of the high energy for 5 watts and 60 milliseconds, you can see that after 3 days, there is a greater appearance of those crusts or injuries. So in size, they're much greater, but they fade away after 1 week, but still there is some redness. So following FSR treatment, tiny crust less than 1 milliliter in diameter usually appears after treatment and can last a few days. The crust should not be touched or should fall by themselves naturally. Other questions that we had, which are important, is the FSR handpiece. Is the FSR handpiece suitable for all skin types? This is a great question. And how can treatment setting be adjusted based on the different skin types and concerns? So this can address this question, showing the relationship between the power and the pulse duration in different skin types. So for Fitzpatrick skin type 1 to 3, typically we move between the default parameters, which are basically on between 3 to 4 watts, and the pulse duration is somewhere between 30 and 50 milliseconds. So there is no much of concern when dealing with Fitzpatrick skin type 1 to 3. As we go to Fitzpatrick skin type 4 up to 6, we should consider lowering the energy altogether by going to different ranges of power, 2 to 3 watts on Fitzpatrick 5 to 6, and 3 to 4 in Fitzpatrick 4. And also pulse duration should be considered to be lowered. And the reason behind it is, of course, we're talking here on ablation, and ablation generates typically high level of temperature between 80 to 100. So we need to be careful on, addressing the right optimal energies with these skin types. That said, we can treat all skin types cautiously and, in the understanding of the relationship between the power and the pulse duration. So as the pulse duration is shorter, so that is the footprint, the thermal footprint. So I would recommend to use short pulse duration in darker skin types. And this is something, and vice versa when we talk about light skin types. So this relation between power and pulse duration should be well understood to you and the clinicians that you address the operation of the FSR. What are the indications of the FSR? Fine lines, wrinkles, acne scars, traumatic scars, skin laxity, and stretch marks. These are the most common ones. So the highlights and benefits of the FSR: its effective epidermal effect for optimal coverage with 300 microns diameter pins with 112 dots gives you a great coverage, also from ablation point of view, and also from secondary thermal effect, optimal volumetric dermal effect on the papillary dermis, owing to the 3D technology. And having all these combined, we can see a lower discomfort through the treatment. Might be accumulative as we do many pulses, so the area might feel a bit more sensitive, and you might feel some stinging on heat sensation. It's minimal downtime. Most patients recover within 10 to 14 days at most, and typically we are applying the FSR in multiple pulses on the face and neck area. So as mentioned, it's suitable for all skin types, minimal risk of PIH, even Asian skin, probably due to the ablation temperature that is optimal to create ablation, but not overheating. Now, can the FSR handpiece be combined with other treatments procedure for enhanced results? Yes, we are bundling, we're pairing intensive and FSR together. As you know, we recommend very much. Both can be used to address two levels of layers of penetration. One is through the epidermis into the dermis, mid-dermis, and the FSR as mentioned to the dermis. Typically, we advocating using it together on the NDI protocol, addressing aged area of the eyes, using this handpiece, applying it according to the protocol that you all should be all familiar with. If you need the protocol, we can send it to you, but it was very well, marketed throughout the last year, everywhere in the social media and so forth. But if you need one, please let us know. So the combination of the two, the periorbital rejuvenation protocol, is simply doing intensive first, followed by the FSR. When doing combination intensive and FSR, and the FSR is the secondary application, one needs to prep the skin by cleaning it up with normal saline, please, as can be, or boric water 1% for disinfection. So this is an important step not to be forgotten when you go from epidermis after intensive treatment, FSR to follow, but you need to clean the area very well. As you can see, the intensive and the FSR can treat delicate area. They are both able to go into these anatomical area. We do 3 pulses of each and so forth. We're not going to go through this protocol again, and we'll do some other combination therapy, any other synergetic effect that may be used with the FSR and the intensive. Yes, we can do it. And on purpose, I gave you here some examples from India, some before and after, showing you the effectiveness of combination, enhancing the FSR and the intensive, doing FSR multi-level subcision with intensive and PRF, which is a plasma-rich fibrin here, 2 sessions, 3 months apart. This is a great improvement. Same session, FSR and intensive, as mentioned earlier. I don't have here the parameters since it was not shared by the doctor, but these are very, I would say, impressive results using both intensive and FSR the same session with dark skin types 4 and 5. So how soon can patient expect to see results after undergoing FSR handpiece treatments? As you can see, it might take, I would say, up to 3 months, at least 3 months, to see good results. And with contraindication, the limitation of using the FSR handpiece, we'll discuss with Asrar in just a moment. And these are issues that we have provided you in the past, and we'll be able to share it again with you. And any combined protocols with the FSR and the intensive for other indications, such as skin rejuvenation, yes, these can be combined, not the same session, but can be spread every 2 to 3 weeks. So intensive and then FSR, alternate treatments that can be followed for the next couple weeks, and this is something that we recommend to do it as well. Pairing iFine with FSR is possibility. With the iFine and the FSR, it has been used in the past and shows very nice results. Now I'm very happy to transfer the second part, the live demo part, to Asrar. She's our clinical application specialist. Asrar, please take the lead.
Hello to everyone. Thanks for joining us today. Joseph, can you please stop sharing your screen?
Sure.
So hi again, my name is Isra. Today I'm gonna present a live demonstration using the FSR handpiece. But before that, we're gonna do a little bit of hands-on. We're gonna start with the basics. And during the session, we're gonna talk a little bit about the contraindications, some protocols, and also the pre and post care. Please, if you have any question, feel free to interrupt and ask. Okay. So as said, starting from the basics, we're gonna start by learning how to connect the FSR handpiece. It's a very simple thing to do. Here, as you can see, we have the connector. We have a large pin here. The large pin has to go here. So you have only to align it like this, push a little bit, and rotate the connector. And like this, as you can see here, the handpiece has been activated. And now it's ready to be used. Okay, moving to the interface, to the screen of the system. As you can see, it's very simple and user-friendly system. Here you can see all the treatment types. Today we're going to do an FSR treatment, so I'm choosing FSR. And here we have the second screen. This is the screen that we're going to stay in the whole treatment time. So from the left, you have all the treatment areas that we can use this application to. We have the whole face, also some areas in the body. And from the right, you can see the parameters that we can easily control and customize as we wish. And actually here, we don't love that concept of levels. We don't like to be blinded to choose levels without understanding what this level means. So here in our system, we have the two parameters, the pulse duration in terms of milliseconds, and we have the power in terms of watts. And of course, when I choose a specific treatment area, I have suggestion or default parameters from the system. And here we have the start and the pause button, and we have some other features that are related to that tip. And now we're gonna try to connect a new tip. Here you can see the tip. We have this in this package, sterilized one. Always remember the tip is single use and you use it only for one patient. So I opened my tip. As you can see, there is only one way to connect the tip to the handpiece. You see the black square here, supposed to be down. So what you're supposed to do, hold the handpiece, hold the tip, align it like this, and push till you hear the click. And here you can see that the trigger is blinking green. That means that the handpiece is recognized by the system and ready to be used. And going back to the screen, we have two features that are related to the tip. The first one is the tip status. We have three different status for the tip. A new tip, it's been never been used before. An active tip that has been used, but you still have some pulses remaining, and an expired tip that you're used all the pulses that you have. And here you can see the progress bar of the number of pulses. So the FSR tip is a very generous tip. We have 450 pulses. And here you can see how many pulses you have remaining. So it's a new tip, so we have 450. Okay. So before moving to our patient, I want to share one slide with you, talk a little bit about it. Can you see my screen in full screen, my presentation?
Yes.
So before starting with the patient, let's take a look at this table that shows different indications along with the recommended settings and number of passes for each one. So when manually adjusting the parameters, we need to keep in mind the following. First of all, the pulse width determines how long is the energy is delivered during each pulse. So shorter pulse widths are suitable for superficial concerns or thinner skin, while longer pulse widths penetrate deeper into the skin and are suitable for deeper concerns or a thicker skin, let's say. So gradually adjust the pulse width while monitoring patient comfort and response. Always note that shorter pulse widths may require more treatment passes, while longer pulse widths can cover large areas more efficiently. The second parameter is the power, as we saw on the screen. So the power setting controls the energy level delivered by the FSR handpiece. So when we adjust the power based on the specific indication and the patient's skin type. So we always start with a default or even lower power setting, especially for sensitive or delicate skin. And during the sessions, we assess the patient comfort and skin response. Gradually, we increase the power as needed while ensuring always that the patient remains comfortable. And for more resistant concerns or thicker skin, we always increase the power level. As said, always monitor the skin's reaction and adjust the power to maintain balance between the effectiveness and the safety. So in addition, skin color plays a big role in determining the appropriate pulse duration. Generally, as Joseph said, patients with darker skin tone have a higher risk of adverse reactions, such as hyperpigmentation or burns, when exposed to longer pulse durations. So therefore, it's preferred to use shorter pulse duration for darker skin types to minimize this risk. And of course, we start with conservative parameters, and when we move on with the sessions, when we observe our patient tolerance, reaction, and skin reaction, we can increase the pulse width or the power. Okay. Going back to our patient. Here we have our beautiful patient. We already did the numbing cream. As you know, before doing a fractional treatment with FSR or the intensive, we need to put some anesthesia. So what we like to do here, we use Endymed. Show you. So here we have the Endymed. It contains lidocaine 2.5% and phyllocaine 2.5. So what we love to do here, we apply one layer on the face. I like to put a plastic wrap, but it's right that scientifically saying it's not proven that the plastic wrap can really help with the penetration of the Endymed. But from my observation here in the clinic, it really does some effect. So we do this thing, we put the Endymed, put the plastic wrap, wait for 20 minutes, and then add another layer, and wait for another 20 minutes. So now what we're gonna do, and of course, before doing this thing, we always clean the face with a cleanser, and then clean it with alcohol 70%. We do the anesthesia, and after that, we clean again. But what we like to do is, I don't remove the whole anesthesia from the whole face at once. I do it gradually. I start by performing a treatment on the forehead. So I remove the Endymed from the forehead, clean with alcohol, perform my treatment, and then move to the second treatment area. And that's what we are going to do now. So just give me a moment to prepare everything. Okay. So as said, we're going to start with the forehead. And then with alcohol 7%, I'm gonna clean the numbing cream, the EMLA.
זה ברור, אני אמרתי בבוקר שהם יהיו 30 זה יהיה בסדר, ככה יצא לי. בסדר, לא, אנחנו מקליטים את זה כמובן, זה בהקלטה.
So as you can see, we choose the treatment area is the forehead. I can use the default parameters. There's no need to change. I press start. And here you can see the trigger that is now green. So just make sure some tips so that the FSR, when you do one pulse, you don't press and release immediately. No, you have to wait for a moment until you hear the end of the sound. Let's make one pulse. Another one. So keep pressing until you hear the tutorial at the end. Okay. Going back to our patient. So now we're going to start from the forehead. As Joseph earlier explained, so here we have the tip. As you can see, the tip has some dead areas, let's call it. So not the whole tip is an effective area. So what we need to do, this is one suggestion that we can do. We can do all the pulses vertically and then do it again horizontally. And this is how we make sure that we cover the whole area of the treatment. Starting now. This is one pulse. So our patient is not complaining, the EMLA is working. You don't have to press hard. Just make sure that all the pins are in good contact with the skin. Another thing, as you can see, we don't see an immediate effect on the skin. So we don't see the stamp of that tip immediately. It doesn't mean that the handpiece is not working. It doesn't mean that you're not doing it right. Just mean that with this treatment, it needs some time that we start seeing the effects. The redness. So now I'm going to do the second pass. Make sure that I cover the whole area. Always work in a very organized way. That's how you don't miss. Now, as you can see here on the screen, we have a message, a pop-up. So let's take a look at the number of pulses. We started from 450. Now we are 420. That means that we have done 30 pulses. And the message on the screen says, please wipe FSR tip using gauze pad, gently absorbed without. So this is the trick that Joseph talked about earlier. And we need now to clean a little bit our electrodes of the pins. So what I like to do is take close pad, put some alcohol on it, put it on my hand. This. And rub the hand per hand, please. Do it gently, that you don't damage the tip. And at the end, just take a look at the electrodes, the pins, that there are no fibers stuck between the electrodes. Press OK, and you are good to proceed. Just remember that this is the thing that you have to do each 30 pulses. Continuing with the forehead. And we have done our first treatment area, the forehead. And before moving to the second one, I just want to discuss with you another topic, the contraindications. Okay. Going back to the presentation. Okay, so the FSR or the system in general, the Pro, any Endymed system, have some contraindications that need to be considered. Here are the general contraindications that you can find in this slide. You can find it also in the user manual, on all of our protocols, and we can send you, of course, this specific presentation. So the contraindications are serious heart or clotting disorders, impaired immune system, active or recent cancer, history of heat-stimulated diseases or skin disorders, of course, pregnancy and breastfeeding. Also, patients should avoid using Accutane for 6 months to a year, depending on the previous dose. Patients should also avoid taking non-steroidal anti-inflammatory drugs, such as aspirin or Advil, for 2 weeks before the treatment to reduce the risk of bruising, unless, of course, the medications are prescribed for to treat an existing medical condition. Additionally, there are local contraindications related to the treatment area itself. This includes tattoos in the treatment area, subcision lesions, recent surgical procedures or treatments in the area. For example, patients should avoid IPL or laser procedures or any other aesthetic procedure in the treatment area for 2 to 3 weeks before the FSR treatment. Patients should also avoid skin irritation or tanning at least 2 weeks before the treatment. And of course, while these lists cover the main contraindications, it's also ultimately the responsibility of the physician to assess the patient's suitability for the treatment using the FSR handpiece based on their medical condition and history. Let's take a look at the pre-treatment care. So as said before, for skin types 3 to 5 can benefit from prepping with powerful ingredients like hydroquinone or glycolic acid. It's an optional step. You don't have to do it if you're not convinced with it. The reason we do this to minimize the risk of hyperpigmentation. We hold off on these topicals for 4 days before the day of the treatment. And the second point talks about prioritize skin health by moisturizing morning and evening for a full week before the session. Always keep the hydration flowing with at least 8 glasses of water. If fever blisters have been a concern for your patient in the past, it's always prefer to take proactive measures. Ask him or her to begin antiviral medication 1 day before the treatment and to follow prescription instructions for peace of mind. Also, give your patient's skin a breathe by stopping topical acids like glycolic, alpha or beta hydroxyl acid, retinols, and retin A for refreshing 4 days leading up to the treatment date. And during the treatment, what we was doing now, shave if needed and clean completely the treatment area with alcohol. Ensure that it's free of any lotion, makeup, oils, perfumes. Always take baseline photos of the treatment area for your reference and for the patient's reference. Before the first session, perform a small test spot if it's your patient first session. You can do it on non-visible area to assess the skin reaction and determine if there are any side effects. Always it's suggested to repeat this test spot if the treatment parameters are changed. You can perform it, you can do 1 pulse behind the ear, that's enough. Wait for 5 minutes, observe the reaction, and then you are good to proceed. Always apply topical anesthetic cream on the entire treatment area. Always clean it with the gauze pad and with alcohol 70%. And for the FSR treatment specifically, use a small amount of ultrasonic gel if you feel that your patient's skin is extremely dry. It should be a very, very, very thin layer. Always inspect the FSR tip pins to ensure none are missing, broken. Never use a damaged tip. And always to ensure comfort during treatment, place a rolled gauze between the cheek and teeth if your patient has some dental crowns or braces or any metal dental implants. Okay, so let's go back to our patient. Do another treatment area, and then we're gonna go back to the post-care. So now we are moving to the cheeks and periorbital area. Of course, we're gonna clean with alcohol. And now before continuing, we are moving to another treatment area. So of course we need to change that treatment area also with the system. So I'm choosing periorbital. I am satisfied with the suggested parameters, so I press start. And now as you can see, the tip status has been changed. It's active now, not new, because we already did some pulses with this tip. Now, we're gonna do some pulses around the eyes. So what we love to do is to stretch a little bit. Please stretch a little bit the skin around the eye. 2. Close. And stretch that you have a good access to the whole area. now we're moving to the cheeks. Again, changing parameters in the system. Cheeks, start. You can hear the sound. From the sound, you can tell that it's a longer pulse width. Let's make some tests. So now if I'm choosing pulse width 10, that's the shorter one, the shortest one, start. And I give one pulse. And when I choose 60, just a moment. Some technical issues, all good. Let's give a system a minute. Again, side, cheeks, start. Going back to the patient. Now I'm gonna do the perioral area. So now I'm changing the parameters. Here we don't have any perioral suggestions, but we can use the periorbital. We can also perform a treatment for the neck area and submental. We choose neck, hands, and start. Again, we have the same pop-up to clean the tip. So once again, we take those pads, spray some alcohol, and rub the tip. Take a look that you have no fibers stuck between the electrodes, and you're good to go. So we have seen how we can treat the face in the face area. Here you can see that we start to see the redness. And before moving on, I want to show you or discuss with you little the post-treatment care. Just give me a moment. Okay. So a possible side effect, or let's call it clinical endpoint. So after fractional treatments, your skin may experience mild to moderate swelling, edema, and redness for 24 to 48 hours. You may also notice some crusts that can last up to a week, depending on the treatment and the settings that you chose. It's important to note that recovery time may be longer when you treat the body, for example, stretch marks or traumatic scars. So for the first treatments, we typically schedule monthly sessions. And to see optimal results, you have to do a minimum of 3 sessions. While for body indications, we do treatments spaced with intervals of 6 to 8 weeks because the recovery time is longer. So always make sure to educate your patient to refrain from rubbing the skin for 5 to 7 days following the treatment, and never peel the scratches or the crusts. So post-treatment. Post-treatment discomfort can be relieved by cooling the treated area with full compresses or soothing lotions. We love to use here BFine. You can use also Vaseline. Apply it immediately after the treatment, and you can put another layer every 2 to 3 hours, of course, as needed. Just give me a moment. Okay. Always avoid any activities that may cause trauma to the treated area during the first 2 days. For example, hot baths, massages, swimming, or intense physical activity, and any similar treatments. Always minimize sun exposure as much as possible, as the controlled damage to the epidermis layer can reduce the skin's natural defense mechanism and lead to post-inflammatory hyperpigmentation. So always wear a white hat, apply a high factor sunscreen, at least 30 SPF, and make sure to moisturize the treated area with plenty of creams, of course, starting 12 hours after the treatment and between sessions. Makeup can be worn 24 hours after each treatment. On the day of the treatment, you can use regular night to day cream. Men should avoid shaving until the small crusts have peeled off, like 1 week. So let's remember that every good story has an ending, and this is the end of the demo part. Thank you for your attention and your time, and Joseph, stage is yours.
Okay, so, some remarks before we end. I just want to thank everybody for attending this session. As you know, it has been recorded and it will be sent to you upon request. I want to thank Asfar for a good job she did on the live demo. Please write us, the clinical team, any questions you may have or material you may want to have available to you. I just want to have a closure remarks. We're planning to do Endymed hour every 6 weeks, depends on the demand, and we will really like you to be involved in picking up a topic with the marketing team, with Vicky and Amir and others, in order for us to bring you the best information, most updated one. And also, we encourage you to share with us some before and after photos, and it will give you, like anybody that will send us a qualified before and after photos, we'll give him kind of show and tell 5 minutes to present it before the session, before the next webinar. So take it as a challenge to make this meeting with us more interesting, or special cases you may have. It can be either doctors or any others that find it interesting to share his accomplishment with any of Endymed's technology. So again, I want to thank you very much for attending. Wishing you a very pleasant day and week to come.